Salam and welcome everyone. I would say good afternoon, good morning, afternoon, and evening. I think we've got people from quite a few continents already. So before we kick off the introductions, I would like to congratulate Ali and the entire Park Launch team for putting together this, I think, fantastic, incredible platform in a very short space of time to showcase Pakistani startups. And I think in current scenario, I think the timing couldn't have been better. So well done and congratulations, Ali. So I'll do a bit of my intro. Asad Khan, I'm a healthcare enthusiast. I'm also the co-founder and CEO of a company called Meds and More. We are the largest health tech company in Pakistan. We are also the largest fundraisers in that space. Before starting this venture, I was abroad for about 15 years, spent time doing some interesting stuff in healthcare space, both in Europe and US. Worked extensively with the NHS on a lot of big data projects with Kaiser, with Blue Cross Blue Shield in the US. Before moving back to Pakistan in 2017 as general manager for Careem, which was still the dominant ride-hailing player in Pakistan. So landing back into the region, I don't think I could have done better in any other place. I think Careem was a fantastic place to land, and I think it's impossible to exaggerate the impact the Careem fraternity has had since their exit in 2019. I think we already have some great people joining in. The list is very good. I'm looking forward to the Q&A at the end. Special thanks to our fantastic panel. We've got representations for this global perspective from at least 3 continents. I think some people can say they have worked in multiple continents, so it could be 5. Just a bit about the webinar before we jump into the introductions. So healthcare is a very, I think, unlike other industries, very personal. And let's say that it looks, feels, and delivered very differently, even if you're living in the West, in advanced countries. For example, in the US, it's very billing based. As soon as you enter a hospital, they start billing you. As opposed to if you're in the UK, right? Their aim is to spend the least when somebody comes into the hospital. So depending on which region, which part of the world, income level of the country, the products and technology and the requirements are very different within the healthcare space. So it'll be very interesting to hear across the spectrum, what's happening in the healthcare space. So this webinar is just a holistic discussions to understand what's happening in the space in different parts of the world, what's happening in Asia, Europe, Africa, and US. Let me introduce the panels. I'll let panelists introduce themselves. First of all, thanks a lot to be here today. I know they are all in different time zones. Janesh is 1 a.m. in Singapore, and tomorrow is Monday. I'm sure it's going to be fun tomorrow, Janesh. So Janesh is managing partner and founder of a health tech and fintech focused fund based out of Singapore. Janesh has been very busy in East Asia and Asia over the last few years. We've got Afsane Jetha with us. Afsane is the founder and the managing partner for private equity based out of UK. It's called ALTA SEMPER. And Afsane has been, I think, traveling extensively, especially to Africa. I'll let Afsane talk about it in a bit. And then we've got Hammad who has been in health tech space for at least a decade, has seen the whole evolution within the healthcare space, especially on the technology and the product side in the US. So I think we've got very rich perspectives that we'll get to hear in a bit. So let me start from the Eastern Front, right? Let me start from the East side. So Janesh, let me come to you first. So I think in terms of where the deal flow is going in the East side. So I know you've invested not just in the East side, but you have worked with East and South Asia extensively. You've been looking at the deal flow for both health tech and fintech. So if I was to ask you, if you give us some broad perspective of what's happening in the healthcare space in that part of the world, and where the deal flow, where the investors are actually looking to invest money. And if you wanted to introduce your fund, you feel free to just introduce your fund.
Thanks, Asad. Thanks everyone for joining. Thanks for the introduction as well, Asad. So we're an early stage fund here in Southeast Asia. We're based out of Singapore, but we cover mainly all the markets across Southeast Asia, from Philippines kind of to the east all the way to Pakistan, kind of towards Central Europe. Our focus is primarily financial services and healthcare, and many people will probably wonder why financial services and healthcare, because they're two very different verticals. But we fundamentally believe that beyond education, which is the other core vertical, these are the two most structurally fastest growing sectors, not just globally, but particularly in Southeast Asia. And the intersection between financial services, particularly on the side of insurance and risk and protection, as well as healthcare provisioning, is very, very strong. So we've invested broadly across very early stage from seed. We've incubated a few companies in the region, primarily on the financial services side, and we're now expanding that mandate to cover healthcare. Healthcare is a personal passion of mine. A lot of my family is healthcare, are healthcare professionals. I'm pretty much the black sheep in my family. I'm one of the very few finance people. And so I've pretty much grown up in a family full of healthcare specialists. And this has become a personal passion of mine in terms of investing as well. In terms of deal flow, Asad, let me just give you some high level statistics. So there's been about $14 billion of investments that have gone into Southeast Asia across venture, both from early stage through to growth. Around about 40% has gone into financial services. It's by far the most prolific sector in terms of capital investment, but healthcare is rapidly growing. Healthcare has taken about 8% in total so far. So this includes everything in Southeast Asia and South Asia, but excludes India. India obviously has a very prolific healthcare sector in itself and has seen a significant amount of capital, but Southeast Asia has yet to catch up. And so for us, the opportunities are very much in three core verticals within healthcare, around delivery and delivery of care, particularly to the last mile, around automation and using data to provide healthcare on a needs basis, and around the intersection between what I would define as credit and insurance and healthcare provisioning, because we fundamentally believe that access and affordability are the key drivers of adoption. And with medical inflation running at north of 14% across most markets in Southeast Asia, the need to fund the gap between demand and supply, frankly, on the infrastructure side, we think will come through digital health. So that's our kind of core thesis and where we stand.
So just a follow-up question on that, Janesh. I think the way healthcare works in East Asia is probably very different to how it's in South Asia, right? So I think in South Asia, for example, in emerging markets, you need to put in the basic infrastructure before you can do something interesting with it, right? So there's no deep tech, there is no data play because the basic infrastructure is missing. Is that something you're finding out when you look at the deal flow coming from these two regions?
It's exactly the same, actually, to be honest, with the exception of, I would say, markets like Singapore, Malaysia, and maybe Thailand, which have deeper infrastructure in place. And because the funding environment in those markets and the development of those markets is far more prolific, the infrastructure gaps in the rest of Southeast Asia are not too dissimilar to what you see actually in the rest of the region. Now, to varying degrees, obviously, because GDP per capita varies quite significantly from Vietnam down to Philippines. But the other big gap that we're fundamentally seeing is around adoption curves when it comes to healthcare provisioning. And that basically comes down to this issue of this demand-supply mismatch in terms of physicians and healthcare provisioning. So for us, we see that gap as one that we want to fill. And for us, we are less focused on the deep tech problems. We're really focused on first principles. Just affordability and access to healthcare is by far the biggest driver of any investment decision that we look to make and any company that we look to focus on. So for us, digital therapeutics, telemedicine, telehealth, anything in the pharmacy value chain, those are very, very fundamental drivers of adoption.
Absolutely, absolutely. I think very, very, very interesting. You know, very different markets. Very different markets would love to find out. You know, what's the synergies? What can we learn from each of the markets? Let's move to a bit of slightly west. To middle of the planet. Afsane, thanks for being with us. So Afsane, as I mentioned, Afsane has been very busy looking at investments, have been very busy traveling to Africa. She lives in UK. So I think would love to find out, Afsane, about the healthcare space in Africa, what's happening in Africa right now. And if you can give us some contrasting comparison between where you live and where you're investing right now. And feel free to introduce the fund if you want.
Absolutely. So it's an absolute pleasure to be here. Thank you so much. I do feel a little lost for words because Janesh actually said a lot of what I was going to say, because there are a lot of corollaries to the markets in which we invest. But a quick introduction on myself and my firm. So I have been investing in the private equity space in healthcare for nearly 20 years. And 6 years ago, founded a business alongside two US families. One is the Estee Lauder family, and the other is the family office of the gentleman who's the chairman of the Rockefeller Foundation, to invest in healthcare across emerging and frontier markets. Today, we are one of the more active investors in healthcare across the spectrum, going from sort of developed markets, infrastructure, clinics, developing markets, but infrastructure and clinics, to more and more health tech. And I see huge synergies and huge opportunities across that whole value chain, which I will talk a little bit in a moment. We own large pharmaceutical businesses, hospital, cancer services business, online pharmacies, etc. What we have seen is actually truly fascinating. We've been investing in healthcare in Africa sort of for 6 or 7 years, really at the beginning of when people started to take a sector-focused approach to Africa. I think historically people viewed Africa as a country and took sort of a generalist approach to investing in those markets. And we took a slightly different approach. And Africa and healthcare is quite a specific market that requires significant sector expertise in our view. How many medical schools, right? And that would take decades, if not hundreds of years, for the continent to mobilize. So I think one of the huge opportunities we've seen is the role of disruptive technology in these markets. And the benefit you have in some of these emerging frontier markets is you do not have traditional incumbent players to disrupt. And you've seen it in other sectors, right? You've seen the continent go from no phones to mobile phones. You've seen it go from no banking to a huge proliferation of fintech. You've seen it go from hugely disorganized retail to e-commerce. And we fundamentally believe the next major shift on the continent that will have huge developmental impacts, but huge economic impacts as well, is really the proliferation of health tech. And we see health tech as particularly interesting when it comes to affordability and access. So another few interesting statistics: we own the largest pharmacy chain in Nigeria, in a country of 200 million people, 776 local governments. Only roughly 450 actually have pharmacies and pharmacists that we would recognize as pharmacies or pharmacists. So you have huge amounts of people who actually have no access to primary care, because the pharmacist really is the first point of care. And so one of the really exciting things we see with the proliferation of online pharmacy and tech-enabled pharma distribution is it's really the tip of the iceberg, right? Once you can reach someone in a semi-urban city whose really only other access is the local market woman to buy antibiotics that may be tempered, that may be legitimate, that may, who knows, right? Once you have access to that consumer and patient, that's really the tip of the iceberg. You can provide primary care, you can provide diagnostics, you can start to think about genomics, and you can actually leapfrog the proliferation of care, we believe, much more significantly than you could in developed markets, because you don't have the Siemens, the Medtronics, the Electas to disrupt. You can actually just provide better, cheaper, faster care through these new business models in a very impactful and sort of commercially rational way. And to contrast it with the UK, that has a very quote unquote developed healthcare system. There are virtually no online pharmacies in the UK that can deliver medicine within a few hours. Like, you can get it in a couple days, right? There are very few places where you can have a phlebotomist come and do blood tests at home, whereas these things are really taking shape across emerging markets because they're better, cheaper, faster. And I think when you look at models like Zipline, for those of you who don't know, there's a drone company started delivering blood in Rwanda via drones. That company recently has a contract with Walmart in the US to start delivering things via drone. So I think we're starting to see the era of frontier markets disrupt developed markets. And it's really quite exciting to be part of that in the healthcare space.
I think that's Afsane, very interesting. I think in Africa, what we have seen previously is the absence of infrastructure actually accelerates digital adoption, right? For example, in case of M-Pesa in Kenya, right? Because so it was like, the basic infrastructure was missing. There was ATM maybe for a city like Karachi, you can probably relate to 10 ATMs for 10 million people. So that lack of infrastructure actually accelerated the digital adoption. I think if the same thing happens for healthcare, I think this could be fantastic. The emerging markets could be using the most up-to-date technology, proliferate healthcare. Fantastic. So moving on to all the way to the West, there's nothing after that, right? So West Coast. So Hammad, thanks a lot for being here. I think when we look at US is very different to most markets when it comes to healthcare, right? It's probably the most innovative healthcare market, but also one of the most inefficient, right? So
yeah,
right. And if you look at the numbers from US, for example, diabetes, right? So the US spent $368 billion on managing type 2 diabetes last year. So the requirements of how to tackle this healthcare spend is probably most critical in US when it comes to sustainability. So just give us the perspective from your point of view, what's happening in the US. Feel free to introduce your company. I think your company. Yeah, sorry, go on.
No, so I mean, coming after everything that Janesh and Afsane have already said, it makes more sense for me to talk about all the challenges that are in US, because technically speaking or technologically speaking, a lot of the things that were said were actually applicable here as well. So just to give the audience, and I know we have a very diverse audience, global audience, so it may be repetitive for some of the US folks, but let me still state these things. So overall, healthcare spend in the US is close to $4 trillion. This is a year-old number, so it could be even higher at this point. The market is structured in a way where a lot of the spend is not coming out of the end user's pockets. Like in fact, the biggest spender is the government. And then we have like self-insured employers, we have insurance companies that are non-government. So what this market enables is a lot of people who want to get healthcare service. They don't take the hit for that cost. A lot of people, it's true for a lot of people. So, however, that is changing a little bit, and that actually creates a lot of opportunities. But still, I would say one thing which I think will stay true is, even though the total spend is $4 trillion, it doesn't mean that we're likely to see something like a Google of healthcare or an Apple, which like multi-trillion-dollar valuation. So what is more likely is a lot of really world-class healthcare systems that interoperate, and each of them can still be significantly valuable. So going back to all the challenges, I think the biggest news here is the pandemic basically created a lot of this opportunity for digital or health tech companies that have been a little bit constrained by adoption. For example, like people are so used to the old way of doing things that even though telemedicine has been around for, I don't know, like 20 years at this point, but it wasn't the main way to get healthcare. However, that is changing, right? And it's no longer just the urgent care scenarios, which was pretty typical early on in the V1 of, you can say, telemedicine. Now it's more, okay, your main doctor could be a virtual doctor around an ecosystem that fills all the gaps that you can't really do virtually. So that's where HealthTap comes in, by the way. We are a nationwide 50-state primary care clinic where basically you get your own doctor and they stay with you. They are your quarterback for pretty much all your healthcare needs. And then we have ways to connect you to the rest of the ecosystem. But yeah, in terms of so yeah, that's my quick summary of the healthcare market in the US, and I'd be happy to talk more as people have more questions.
Out of curiosity, so because of the unsustainable spend in US. So when I was working in healthcare in the West, there was a lot of emphasis on the preventative care. So we were trying to collect huge amounts of data from lots of different primary healthcare, secondary healthcare, connecting that patient data at patient level, and trying to prevent people ending up in hospital or predict onset of disease, etc. Is that the trend you see? Is that the investment trend you see, that a lot of investors are looking for these kind of companies?
That is definitely one of those trends. And I would say the other few trends are anything that can make the doctor shortage less problematic, meaning tools that are that will save time for the people who have been like trained for tens of years, right? So tools that that help doctors save time. In fact, all providers save time. And then the other trend is like bringing the hospital to the home, which is you don't have to be like in waiting rooms and so on. So that is a pretty major change. Like, and it's one of those things which is not done by one company. Like it has to be a mixture of technology systems that interoperate, right? So the interoperability is a big thing, where every company has to now connect to maybe a few hundred different systems, and how fast, like, it's not easy. So right now it's an open call for entrepreneurs. Like if you can make that easy, that would be awesome. But yeah, prevention is definitely basically like with the advent of all these sensors that you already have, and like very cheap, like everyone can have several of these on yourself, and then all the data that we gather from it, and then we can say, okay, basically you are on a wrong trajectory, you need some intervention, so a doctor can intervene. So those things are definitely the wave.
Yeah, I'm really looking forward to a hospital popping up in metaverse, soon enough. Yeah. Okay. So let's dig a bit deeper, and let me start from Afsane. Afsane, I know you have a keen interest in the pharmacy space and probably in the medicine supply chain, and you've seen quite a lot of companies popping up, and especially in the emerging markets. So my question would be, where do you see the innovation coming from? Maybe in the retail pharmacy space or medicine distribution space. Where do you see next set of companies trying to solve an emerging market in that space?
If I knew the answer to that, I'd probably be retired. So I will happily give you my guesstimates of the future, having now been invested in the healthcare space globally for a bit more than 2 decades. So one thing I wanted to premise it with, and I think most of the people on this call are interested in healthcare and sort of the evolution of healthcare. And there's a really fantastic article called 3 Mistakes in US Healthcare That Emerging Economies Can't Afford to Repeat. And it's by HBR. And I think it's really poignant because it talks to a lot of the problems that health tech companies are trying to solve, that actually can systematically change and shift and enhance the way a public health system works. And a lot of how I view innovation in this space focuses on a lot of those things. So the key takeaways were, don't just focus mainly on sick people, because that's not efficient. Secondly, don't base a system on just fee-for-service payment, because that's not, that efficient economically. And, don't prioritize just physical infrastructure. There's other things in healthcare around that. So on those kind of themes, which I thought is relevant to the general conversation. One of them I touched on already, that I think in many, if not most emerging markets, the pharmacy is the first point of primary care. I think there was some study by the African Development Bank that it would take Africa 200 years at current population levels to grow enough doctors, right? So that, again, is not realistic. So how can the pharmacy sector and the tech-enabled pharmacy sector really approach the human capital gap, not just, the financial capital gap, and both of them, are needs in emerging markets. I think the way we see probably 2 or 3 trends in the pharmacy space evolving is, again, the pharmacy sector, B2B and B2C, being the tip of the iceberg for other adjacent, primary care services, right? So whether it's telemedicine, whether it's mobile diagnostics, whether it's treating people based on genomics and precision medicine. I mean, it is, aside from the concerns, and I see a lot of the questions on the chat, which are relevant around data protection. I mean, imagine you could create a healthcare system where, your phone knew your genomics and is suggesting chronic care management and patient care management based on your predisposed genetic disease. Like that would be amazing. And I think once you have access to the consumer and you solve the challenge around privacy and heaven forbid that information gets into the hands of an insurance company, that could be a really interesting way to upsell consumers and actually provide a better, faster, cheaper service. I think to some of the things Jeanette had said around and Hammad had said around wearables, once you have access to the consumer, being able to kind of track their chronic diseases and their general health through wearables, I think could be really, really interesting. And you're starting to see a lot of this in the US that's proliferated by the pharmacy space. And I think two more is the role of data. And I know this is something Meds and More is doing, and we're quite excited about, once you provide pharmacies an ERP system and the ability to actually use data and even eventually AI around understanding procurement trends, disease patterns, that just makes the whole system much more efficient and effective, and actually can really benefit the public health system too. You could use that data and provide it to governments to know where there's like high disease burdens to more accurately treat populations, and theoretically you should get paid. You should get paid for that. And I think the fourth thing that we're excited about, and I think I heard Janesh talk about this, and I will talk about it a little bit later, is I think there's a lot of learnings from the CVS Aetna merger, right? The big challenge in our markets is you can have great technology and great infrastructure, and you can solve the human capital gap. But what about the payor, right? In many countries, you don't have state-sponsored health insurance. You don't have people who have private health insurance. So we see a very, very exciting nexus with specifically the pharmacy and pharma distribution and the role of really micro health insurance. I think once you solve that challenge of how do people in a risk pooled way pay for primary healthcare services, you unlock a huge patient pool, and you create just a better health system, both public and private. So this kind of nexus between insurance and healthcare, and making it really local and micro for us is kind of the future, and we're very excited to see how that trend plays out.
Yeah, absolutely. I think you've, so in places where the resource shortage is so critical, how do you make sure that the resource available is utilized to the max, right? And it's only the technology that can enable that. And also, I think I've seen, living in the West, I saw pharmacists being used more holistically than pharmacists in emerging market. And in developed world, there's a much better infrastructure. There are doctors available, there are GPs available. In emerging markets, even the pharmacists are not being used as much as in developed markets. So I think there's a lot of learning curve that needs to happen in Africa and emerging markets. So when I was moving to Pakistan, I wanted to bring all the data science to Pakistan and do all sorts of interesting things. And then I found out that most hospitals wouldn't know how many people walked into the hospital today. So there is a lot of front-loaded investment that needs to happen. So Janesh, I think, so in healthcare historically has lagged behind other industries. So let's say if I talk about, I think one question I ask normally when I'm speaking at a seminar or something, that how many people in the audience have all of their financial history on their mobile phones on touch of a button, and it's almost 100%, right? Everybody has got their entire banking history, and not just today, for the last 15-20 years they've had it. And then you ask the audience, how many of you have got all of your medical history on the touch of a button? Right, 10 years ago, there was zero. Now you see 1 or 2. So healthcare has always lagged behind where financial services, or for that matter, retailers, right? Tesco started doing club cards, 20 years ago, and they started using supercomputers. So healthcare has lagged behind. So you sit in a mix of, that convergence of fintech and healthcare. Maybe is there something that can come from those industries which are much more mature in terms of technology into healthcare? So I was thinking maybe let's one of the things, maybe BNPL can come into the hospitals, right? And they can pay for healthcare in installments.
Yeah, I mean, I think BNPL is not a very cool word today in fintech anymore. Consumer unsecured lending has not had its day in the sun with BNPL. I look at it slightly more holistically. When you think about the consumerization of healthcare, which is the thing that you're talking about, you have to look at the market structure. And in Southeast Asia, the big problem in market structure is that roughly 90+% of markets in Southeast Asia is out of pocket. So it's either insurance driven, employer driven, or out of pocket. Universal healthcare exists in only 3 markets, and even then it's fairly poor. The human capital gap means that financial services in particular, which are the funding sources where the paying comes from, have to bridge that gap. So on the traditional financial services side, we're seeing a lot of credit solutions around healthcare provisioning, particularly in some of these markets. And it's interestingly happening at the pharmacy level. So where, affordability for chronic disease management, say diabetes, which is fairly expensive, even from a generic drug composition standpoint, requires the pharmacy to provide credit terms to diabetics in some economies in order for them to be able to take the modicum of care that they need to manage their diabetes. So buy now, pay later, whilst it's a pretty horrible word today in fintech, is actually already happening, but it's happening on a needs basis, right? And where chronic disease requires that, it's very clear. The other thing that we've noticed in credit, and this is for me, quite alarming, and it's one of the big reasons why we're very focused on this aspect around micro, which Afsane mentioned, is that 35 to 40% of every bottom of the pyramid customer in Southeast Asia ends up in some sort of bad credit due to a healthcare event, emergency or otherwise. That's a staggering number. And then you add in the supply side issue, which is that 14% is the average medical inflation cost of drugs, healthcare services, and primary care across most markets in Southeast Asia. And the provisioning is just so heavily lacking because the infrastructure gap at the top of that conversation that we had is also a big issue. So we're trying to solve so many problems in the face of rising costs, lack of affordability, lack of credit terms, right? And health insurance, by the way, as a percentage of overall insurance premiums in Southeast Asia is a staggeringly low percent. It's 2%.
Wow.
2%. So when Hammad talks about 4 trillion, I'll give you a perspective on what Southeast Asia is collectively, ex-South Asia. It's less than 800 billion. So 670 million people have roughly about $800 billion of investment on an annual basis going into healthcare. It's just orders of magnitude different. And if you think about the waste in the West, we'd love to have some waste in the East. It just doesn't happen, unfortunately. So then the driving force is, how do you find that intersection? And there are 2 areas that we love. One is something called earned wage access, which has been quite prolific. Earned wage access is a big theme globally that we like on financial services, because it's not just about financial wellness and educating the average person around their financial kind of wherewithal, building their credit scores, giving them access to their salaries, educating them on financial products, which are very critical, but it's also the delivery mechanism to provide microinsurance for healthcare. And so both financial and healthcare become intertwined once you can figure out a form factor through which you can educate and essentially drive awareness at the consumer level. And within the value chain, you've got various constituents, right? So you've got the pharmacy value chain, you've got last mile delivery care for not just drugs, but also, healthcare workers. All of these things drive a huge amount of access and affordability, which I think is one of the big drivers, at least in our investment thesis. That is the reason why we have invested in probably the number 1 or 2 EWA player in every market in Southeast Asia. And we're quite proud of it, because this will become a multidisciplinary, multi-sectoral approach to attacking the bottom of the pyramid and providing the type of healthcare services at a price point that makes sense. If you take out a healthcare policy in Indonesia today, less than 5% can afford it. But if you can provide micro insurance and you can pay premiums on a monthly basis, that changes the outcomes and changes the landscape materially. And one of the things that we see in this part of the world, which is unfortunately a trait of the West, is fee-for-service. And I personally think fee-for-service is a disastrous way of providing healthcare services in this part of the world. So whilst value-based care is talked about a lot, I do think it will take time for that to happen. And I think that if you think about the fundamental needs of the average person from a healthcare perspective, ensuring that they have affordable and access, basically affordable access to both financial services and healthcare becomes a primary driver of adoption.
I think that's a fantastic way of putting together, where is the convergence? InsurTech is and the basic criteria of being able to afford healthcare and the financial aspects of a person. I think that's a brilliant example of how these two industries are.
Yeah, and the worrying thing for me is that today you cannot buy a healthcare policy unless you pay your premium upfront. This is absurd. This is absolutely absurd. This is the 21st century. You should be able to pay your premiums on a monthly basis, but most insurers do not want to take that risk. So when you can change the way that the coverage and the provisioning of healthcare services through insurance can be managed, you get much better outcomes. Now, interesting enough, it's happening in India, and it's happening at the kind of SME and consumer kind of insurance package levels. But it's also happening now, we've seen in Vietnam and increasingly in the Philippines, because in both those markets, there's a little bit of universal healthcare that underwrites some of that risk.
Yeah, fantastic. So Hammad, I don't know how much of that you can relate in US market with so much excesses, but I think would love to understand, how so let's say over the past decades, how you have seen products evolved within the US space to represent some of the constraints that it's facing right now.
Right. So I think before I do that, I want to just acknowledge that what Janesh just said, which is you can call it the sins of our fathers, where the fee-for-service model is pretty much one of the reasons why we are in this situation where we spend $4 trillion, but still a lot of care for a lot of people actually gets done in an urgent care or an emergency care scenario, right? So it's not a system that is designed for overall best outcomes. It's pretty much designed for a lot of individuals doing what they think is the best. So anyway, the systematic, or if we take a systemic view of it, now we are converging towards, so a few trends are happening. The value-based care, people are recognizing that, yes, that's a way to control costs, where using a lot of the data that's now available, we can say, okay, so this group of people requires a much deeper engagement level, and therefore caring for them should cost more. But for some other folks, it may make more sense to focus on preventive care in a very different way. So that trend is definitely there. However, what the other things that are going on are like things that help, for example, companies like ALTA are doing, which is changing how people pay for their care. For example, the high deductible model, which is, okay, you are insured, but up to, let's say, $10,000 per person per annum cost, you still pay out of pocket. So what this forces people to do is to say, okay, where can I find the best value? And when I'm paying out of pocket, essentially, then I don't want to always go to the Stanford hospital, or I don't want to go to Mayo Clinic for my small thing. So you basically like you find the best care at the best price. So yeah, I think the convergence of fintech and healthcare is happening in the US as well, where there are models which are basically figuring out how to deliver efficient care where it's affordable out of pocket. You don't even have to involve your insurance, because eventually your deductible is still so high. So anyway, I think that's what I'm seeing here.
Yeah, so sounds like maybe in later years we'll see some of the innovation happening in East, moving towards West, because so far it's been one-way traffic. We'll probably start to see some innovative models, tested out, tried out in the East, find their way to US. I am conscious of the time. I want to leave some room for Q&A. I can see a lot of Q&As in our screen. So maybe we can wrap it up with a question that's on everybody's mind, which is the current investment climate. So would love to open it up. I think you can answer, whoever wants to go first, is how has current investment climate changed? Where investors are investing their money, what has changed, and what should the entrepreneurs be focused on, especially from the health tech perspective? Any volunteers to go first?
Sure. I mean, I'm happy to go first. I think for us, nothing really has changed. The reason I say this is I've been in capital markets, and having been an ex-investment banker myself, I've seen enough cycles to know that this is yet one of those cycles. I think we've been fortunate to have a liquidity fueled environment for so long that some of the excesses have not been a very good driver of value creation. But if you think about first principle problems, they still need to be solved. There is still some huge needs and demands and growth that frankly exists in particularly the part of the world that I concentrate on, which is Asia, Afsane probably for Africa as well. Interesting enough, I grew up in Africa, and I know that gap exists today as it did when I was there. But that gap never seems to shorten because just the lack of funding has been the biggest issue that drives this issue globally. So I think if you can take a longer term view, and particularly on venture, you can take a long-term view, right? And we have a 10-year investment horizon. And so our thesis is to focus on, markets and opportunities where you have found the best entrepreneurs delivering value. One of the main reasons we discuss founder-led businesses and why we invest in founder-led businesses is because we want to back individuals like you, Asad, right? The market structure, what the problems are, how to tackle them, you're capable of building a great team. And, we don't have to worry if the markets are bad for the next 1 or 2 years. There's a question around Pakistan macro. Again, I've invested in emerging markets most of my career. These are cycles. My second day in my career when I first started was in 1998, just as the entire Hong Kong market crashed. These things happen, but the fundamental kind of demand supply of healthcare services, financial services, education, they're not going to go away. And I generally tend to prefer going to where there is still growth, and growth will frankly exist more in the East than it will in the West.
So sounds like you guys are actually long and looking for good opportunities. So not much has changed. It's just that if you were investing in solid companies, solid founders previously, it's the same even in this climate. Yeah.
Correct. And I think that the big difference now is we do care about founders who understand unit economics. There's been a lot of irrational investing in venture, which I think we can all laugh about. I mean, you mentioned the metaverse, but this is a byproduct of excess liquidity. So I think what you're going to now see is much more rational investment going to the opportunities, the founders and the businesses that are delivering real value. So that's, it's great, frankly. And for us as VCs, it's nice to finally be able to invest in businesses that actually are delivering real returns.
Awesome.
Yeah, I'm happy to add to that. Interestingly, just yet to contextualize it, my first day of work was September 10th, 2001. So also, the day before 9/11, the day before sort of a lot of the markets crashed, and have been through several cycles as well. And one of the things looking back at my career is you tend to find the stronger businesses survive these downturns. And in a way, I would sort of take a contrarian view to the current market cycle, that I think it will play favorably to businesses like Hammad's, to businesses like Meds and More, who actually provide a legitimate, better, faster, cheaper service, right? It is in the markets where, the US and even in growth markets, there is still a huge challenge of affordable access to quality healthcare. There is still a challenge of moving away from the fee-for-service model to kind of providing healthcare that's preventative and primary care focused. And I think ultimately those are better business models, and better from an impact perspective. And so I think, while markets have corrected and it may be slightly more difficult to raise, earlier stage venture rounds, I think it will play very favorable to founders who do understand unit economics, who do understand that eventually the goal of all businesses is to, one day be profitable. Eventually the goal is to provide a market differentiated service, and to, be able to communicate what that is. Are you competing on cost? Are you competing on quality? Are you competing on innovation? It can't be all of those things, right? I think it has brought discipline back to the way in which money's being raised, but I actually, from a contrarian perspective, will say that I think it will play favorably to health tech businesses who actually provide a legitimate differentiated service. I think the way in which approaching the markets will change. I've been in the private equity space 19 of my 20 years of working. I would say in the last year, we've done things that would be categorized more as venture, but we do still take a very first principles disciplined approach to investing. And perhaps that's why we lost out on several deals in the last couple of years. But being able to articulate, what is your barrier to entry? What are your current medium and long-term unit economics? How can you change your cost base if the current quote unquote downturn prolongs, or it takes you longer to raise your next round? How do you see yourself differentiating yourselves from competitors? What do you see coming? I think I am Canadian, so one of the quotes I love is, people ask Wayne Gretzky, why were you successful? And he said, I skated to where the puck was going to be, not where it was, right? So can you have a legitimate data-based analysis of where your industry is evolving to, and how will you also evolve? And I think being able to do that will actually differentiate people in, particularly the health tech space, particularly in emerging markets where there is a lot of white space. And so I'm actually very cautiously optimistic about this next cycle. And I think it will play well to people who have sort of a disciplined approach to growth and innovation.
Yeah, absolutely. I think a lot of smart entrepreneurs will adjust and will prevail, adjust their business models. I think in the health tech, there are a few questions popping up, especially on the sustainability on the healthcare model side. For example, telemedicine and similar startups coming up, and they still are finding it hard to find a sustainable or model where they can actually monetize these services, etc. So I guess this climate will force them to find a sustainable model. There's a question which is very relevant, since I'm sitting here and I know 3 people who are going to Pakistan to get their teeth fixed. So medical tourism, right? So, and they're asking in emerging markets, what, are there any opportunities that, that might get investors interested in medical tourism? Because there's a lot of traffic that goes from west to east, especially for medical tourism. Any takers on that? It's a niche space, I guess, but not with the market.
Yeah, in Asia there are 2 markets. One is Malaysia and the other is Thailand. Thailand tends to attract a lot of intra-Asia medical tourism, more so on the vanity side than I would say on the chronic disease side. Malaysia tends to be slightly different because it attracts a lot of Middle Eastern and Islamic medical tourism for specific reasons. I think chronic disease management, particularly across the Middle East and actually frankly across South Asia, is becoming a big issue. I just saw some overnight statistics for India which was shocking. The highest percentage rates of diabetes, for any emerging market in the world. And that's quite staggering when you think about where India is in its kind of own growth curve. But for them, this chronic disease management issue is becoming one that either has to be managed onshore, domestically, or where there's affordability done through medical tourism. We don't like medical tourism as an investment thesis for the simple reason that it doesn't really attack and tackle the big issues that we've been discussing in this call. They tend to be very much for those who can afford it. And I think that these types of businesses can be profitable. They're interesting, probably more from a PE perspective, but certainly not from a venture perspective. And so, yeah, that's just our view. But there is definitely medical tourism in the region.
I would say similarly, there's sort of 2 or 3 markets in Africa where there is medical tourism, and there's kind of different aspects of it. So one of the more prominent ones is South Africa. So a lot of sub-Saharan Africans will go to South Africa for sort of like tertiary care. So it's not getting your teeth fixed, but it's, there's a huge dearth of provision specifically in cancer care across sub-Saharan Africa. There are many countries who literally don't have a single linear accelerator, so they cannot do radiotherapy treatment in country. So many people from Uganda, from Ethiopia, will travel to South Africa. And so in that sense, and we also do own, I believe, the largest group of cancer-focused hospitals in Morocco, and we see a similar trend of medical tourism from West Africa to Morocco, largely because of the language. So it's both Francophone countries. It's a double-edged sword in a way, in that, in one sense, it is tragic that there isn't cancer provision, and even some basic diagnostic provision in many sub-Saharan African countries. The other challenge of that, and also, a huge opportunity for the health tech space, is it's a bit like the challenge of the telecom sector years ago, right? There were whole parts of Africa who had no access to telecoms, to mobile phones, because the unit economics of putting up a telecom tower somewhere in a rural town outside, Dakar just didn't make sense, right? So similarly, it doesn't necessarily make sense to build a radiotherapy bunker in every African village. I totally get it. But, you also don't want to run the risk of overwhelming the domestic systems, especially as the populations age and the disease burden shifts from communicable to chronic diseases like heart disease, like diabetes, like cancer. So I think, there are some exciting diagnostic tools that are being used that are better, faster, cheaper to diagnose early stage cancer. A lot of them using AI-based imaging, which I think is really exciting. And then, hopefully in the years to come, there will also be, whether it's precision medicine-based, genomics-based, or even, like physical technology-based ways to sort of treat cancer in country. Similarly, a lot of people travel to Morocco and Egypt for cataract surgery, for complicated eye surgery. And a lot of that happens to be human capital related. There are not enough eye surgeons in sub-Saharan Africa. And so it is a great opportunity, because I feel maybe separate, not getting a hair transplant in a different country, that's really not moving you further to the SDGs. I think medical tourism is an opportunity, but I think the longer term goal has to be able to provide the human capital and the access, ideally through disruptive technology, to get that treatment in country. And if there's a way to facilitate that in the interim through medical tourism without breaking the domestic healthcare system, we would be supportive of that. But I think longer term, both the public and the private sector need to think of ways to have that provision in country, because otherwise it does just become for the wealthy, and it doesn't, move the SDGs and the overall like health of the community forward.
I think that is so whoever asked that question, there you have your use cases, right? So I think Afsane has done quite a few use cases you can explore in medical tourism, and also the right focus areas. So there is scope in that, but you got to find the very strong, right, scalable use cases in there. So I think within healthcare, we've got a few minutes, but I don't think we can wrap up a health tech or healthcare discussion without talking about data privacy. And I can see quite a few questions popping up. So I spend a lot of time in the West. half the time in health tech space, maybe of a decade, maybe 2-3 years, I spent in front of CAG, ICU office, CNIL in France, trying to get access to data from hospitals, right? Trying to get access, and huge amounts of regulations are GDPR and etc. This is a challenge in emerging market, right? So emerging markets, there aren't enough regulations. So how do we see this going forward? How do we protect patient data? How do we put these or force these companies to bring in regulations which are already, quite entrenched in the West? Any takers?
So it is a great question, and it is extremely relevant. I would hope that the businesses operating in this space understand that it is a reiterating game, right? The space is nascent and it's providing a great service, and thus far has not been heavily regulated. And these new disruptive technologies have taken hold and provide great unit economics and great service to the consumer. And by and large, the regulator in most of the markets in which we are operating have taken a cautious look and see perspective. Not in some markets like Egypt. It's been very difficult to launch online pharmacy as an example, and that's for a whole host of other reasons, because there's really kind of an incumbent lobby from bricks and mortar pharmacies, etc. I would hope that some of these companies would realize they need to very carefully self-regulate, because they will literally destroy the market for themselves and for others if they get this wrong, right? Because in emerging markets particularly, especially if you tiptoe in early and make a massive mistake, the pendulum massively shifts. And it could be that the Ministry of Finance, the Ministry of Health, et cetera, will take a very big stick to almost like a hairline fault. So I would really hope that there are industry groups and the leading companies are looking to self-regulate, looking to work closely with the regulator, looking to be transparent, looking to look to best practices in other markets, really for their own benefit. I would hope it's also because they are interested in stakeholder capitalism and care generally about the moral fabric of society. Even if they don't, it's really in their own self-interest, right? It would be a terrible thing for the industry to get this wrong and for it to essentially pollute the viability of the industry going forward from a regulatory perspective, to not take it seriously. So I know that's not a very concrete answer, but to me that seems like the most viable way, because I feel in many of these markets the regulator is not sophisticated enough in that this challenge hasn't existed, right? So I think if you were to try and regulate it from a government perspective, you're going to get something pretty archaic and pretty draconian that will sort of stifle innovation. So my answer to that is people just need to be a bit enlightened about this is in their best interest to get it right from the beginning.
Yeah, I guess that's the challenge between finding a balance of putting too much because a lot of money comes from the country where those regulations are quite well established. The data sharing practices are quite well established.
So I would add one thing here. I think it's entrepreneurs that are competing against each other. That's definitely, as Afsane said, they need to know that this is in their best interest, but also the investment community, like they need to not apply the wrong type of pressure, or in fact give the right incentives to take the long view and do the right thing.
Absolutely. With that, I think our time is up. I think healthcare is such an expansive topic. I don't think any amount of time will be enough to discuss, especially perspective from 3 separate continents. But I really grateful to our panelists who have taken time out to be here to share their perspective. Janesh, Afsane, Hammad, thanks a lot. And also thank you for all the great people joining. I'm sorry we ran out of time. There's a huge list of questions that came up, but hopefully we'll have a follow-up session sometime, and we'll keep these questions as a backup. Thank you. Thanks a lot.
Thanks for having us.
Thank you very much.
Thank you very much.
Thanks.